Hey, so today I'm going to be talking about the acoustic neuroma surgery, also commonly called as the vestibular schwannoma. The topics that I'm going to cover today are: what is vestibular schwannoma, what are the causes of this condition, what are the symptoms of this condition, what are the treatment options available for this condition, what are the types of these conditions, the diagnosis and the investigation required to confirm the condition, what is the follow-up care required for this condition, and what is the cost of managing this condition in India, surgery and radiotherapy included. Acoustic neuroma, also called as the vestibular schwannoma or a tumor of the cerebellopontine angle, is a non-cancerous condition. It is a tumor of the nerve that connects the brain to the ear. It is responsible for hearing and the balance in the body. So a tumor on that nerve affects your hearing as well as the balance. It does not spread to other parts of the body, but it can cause severe disability because it affects the hearing and the balance of the patient. What causes acoustic neuroma? There are no definite known causes for the acoustic neuroma, but certain factors have been supposed to be contributory. Continuous exposure to thunderous loud voices and radiation exposure are considered to be responsible for the acoustic neuroma. Basically, the Schwann cells that found the outer lining of the 8th cranial nerve start increasing in number, increase in size, and thus form this tumor and start compressing the brain, which gives to the symptoms of the pain as well as loss in hearing. Genetic condition called as the neurofibromatosis is also responsible for acoustic neuromas. What are the symptoms of acoustic schwannoma? The three commonest symptoms are tinnitus, that is ringing in the ears, second, loss of hearing, and third is vertigo, that is loss of balance in the body. The other uncommon symptoms are dizziness, confusion, headache, and loss of sensation on the face. A patient can present with one or multiple of these symptoms. What are the types of acoustic schwannoma? There are basically two types of acoustic schwannomas. First one is unilateral schwannoma, which happens only in 1 year. The general age group is 30 to 50 years of age, and this is one of the commonest schwannoma across the globe. The second is the bilateral schwannoma, which happens in both the ears, and a genetic condition called as NF2, neurofibromatosis 2, is responsible for this condition, and it can be present in young adults because of the genetic predisposition. What are the investigations to diagnose a vestibular schwannoma, also called as an acoustic neuroma? The three commonest investigations are the audiogram, also commonly called as the hearing test. Second is the CT scan, which can be enhanced with a contrast dye, and third is the MRI. These tests help in determining the exact location and the size of the acoustic neuroma, and then it is determined that what procedure, radiotherapy or surgery will be best used to handle this condition. What are the treatment options for the acoustic neuroma? Basically, there are three modalities to handle this condition. First one is wait and watch. For tumors that are very small, no management is required, and just a follow-up to see what is the progress in size every year needs to be done. Second, for tumors that are mid-size, generally radiotherapy is the best option. SBRT, called as gamma knife and cyber knife, are supposed to be the best options. Basically, what radiotherapy does is inactivate the cancer cells and regress the large grown cells so that they reduce in size and do not cause any symptoms. Because acoustic neuroma is non-cancerous in condition, it is not necessary to remove it because it will not cause any problems to the patient. Third option is surgery. It is basically reserved for patients who have got very large size tumors and are causing severe symptoms to the patient. In such cases, surgery is the only way to manage the condition. The success rate of the acoustic neuroma surgery is very good, about 97 to 98%. You just need to be under the follow-up of your neurosurgeon, with repeat MRIs to be done approximately every 6 months. The cost of this surgery or treatment is in the range of $5,500 to $7,500 in India. It depends on whether you're going for radiotherapy or whether you're going for surgery. Again, surgery cost is dependent on the brand of the hospital, expertise of the surgeon, what is the seniority of the surgeon, and how bad is the patient's condition to begin with. This is all the information that is covered for you. I hope you have been satisfied with all that we could offer you. Please let us know if you or any of your relatives is looking for the management of this condition or any treatment in India. We will be very glad to help them. Thank you.